That's right. It is the morning show right here on Facebook, Instagram, YouTube, Periscope TV, and LinkedIn. Glad to have you with us. And hopefully we will have a 100% connected show. Right now we're having internet issues. If you guys are out there, let us know if you're having internet issues as well. Evidently, it's a thing. Mercury retrograde. Do you believe in it? Technology always ends up, those that know about it swear by it. And I used to be a naysayer about it until I started watching things go awry during. It's a weird phenomenon.
10 seconds.
Some know it, some don't. And some care, some don't. But there you go.
2 seconds.
All right. That's right. It's the morning show right here on ABC News Radio, KMET 1490 AM. Joining our live streaming audience there, Facebook, Instagram, YouTube, Periscope TV, LinkedIn Live, Apple TV, and much, much more. Glad to have you with us on today's show. We got lots of information, including this. We're going to be speaking a little bit down the line to returning guest from patientrightsadvocate.org, Cynthia Fisher. And we're going to talk about a little bit pro-Trump, something that is in the bill, which I think is something we all can learn from. The healthcare plan, which included an issue that 90% of voters actually want, according to this information. Healthcare price transparency. Do you agree with it? I agree with it. The inclusion of healthcare price transparency is something that the current president, has talked about as part of his campaign. And according to this, soon hospitals and insurance companies will be made to post their discounted cash prices and secret hidden negotiated rates. And so President Trump is being applauded for this and breaking down the barriers, unleashing competition, innovation, and consumer choice. Of course, restoring accountability and trust in the healthcare system. So this particular nonprofit, very, very adamant that President Trump is good to go. They said this: I applaud President Trump's inclusion of healthcare price transparency and willingness to stand up to the deep pockets of the hospitals and special interest groups. It's more important now than ever during the COVID-19 pandemic to put an end to patients being blindsided, overcharged, and even sued by hospitals for bills they cannot afford and prices they cannot see in advance. Goes on to say the Trump administration and this healthcare plan give all Americans a vision for the future and hope for protection from undisclosed prices. The inclusion of healthcare price transparency in this plan shows President Trump's commitment to an executive order he signed last year while providing a tremendous stimulus in saving to individuals, businesses, and our economy. And they go on to say, thank you to the Trump administration for continuing to fight for the American people and for working to make healthcare price transparency a reality. As you know, I'm the first one to always say something about President Trump, but I always say this: if he does the right thing on something, let's bring it out, right? We all have something that we can learn. It's not just because they're guests. I actually scheduled this appointment for us to interview because, again, it is a good discussion to have. When it comes to price transparency, it's kind of interesting and alarming. We've had other companies on before that talk about, there's a certain app out there. I think it's, I can't remember the name of it, GoodRx or something like that. And you could find out where you can get your medications at for a lower cost, right? You type in your location, and all of a sudden you find out you can get a little bit lower versus Walgreens versus CVS versus maybe another location. And you can check it out, right? That's a version, not full transparency, but it's a version of competition, right? Oh, I could get it cheaper over there for less than like where I get it over there. My copay is, what's the difference, right? So I'm not against this. I'm actually 100% for this. So, let's talk about it and keep an open mind. Okay, keep an open mind. Look, as I've always said, both sides of the aisle, people have to learn from both sides of the aisle. Okay. Granted, I don't think President Trump is the one who came up with this idea. I think it was obviously somebody behind the scenes, as it normally is. But I'll give credit where credit is due. Okay. And we'll talk to the patientsrightsadvocate.org and talk about what it is they've been doing behind the scenes, because of course they're a nonprofit, nonpartisan organization that's according to their headline, that provides a voice for consumers, patients, employees, employers, and taxpayers to have transparency in healthcare. So I have a feeling even if the Democrats did it, they'd be like all up in arms about, yay, like, thank you, Democrats, right? So whoever's like trying to do the right thing, that's what they care about. And I think that's what they care about. And so we'll talk to her a little bit later on that particular subject. All right. With that, we got Mr. Jesse Sanchez just kicking it up over there. Good morning, Jesse.
Good morning.
Lots of interesting news in the headlines, Jesse. One of which you brought up to me that I had no idea about. Ice Cube. I'm not talking about the, when you have like a really hot day. I'm talking about the rapper / actor / producer / extraordinaire. Smart man, by the way. Right, Jesse?
Yeah, I give him props for what he stands up for what he believes in. So even though people are commenting he's a traitor and all that stuff, I give him props for trying to help.
Yeah, let's go into the news story here. According to this headline, this one's on Yahoo News. Ice Cube helped develop. This is their headline, by the way. Actually, I'm going to wait to say the headline because the headline kind of skews it in one direction versus another. Here's what happened. Ice Cube, according to what is being seen or touted as, Ice Cube worked with Trump's re-election campaign, and fans are not happy to hear it. That's kind of the first headline, but you have to wait to hear the rest. Okay. The rest, on Tuesday afternoon, Trump 2020 senior advisor Katrina Pearson posted a tweet thanking the hip hop veteran for his willingness to work with the Trump administration on the Platinum Plan, which is a $500 billion package that will help Black communities. Now, the plan, according to this, is to create 3 million new jobs, push for criminal justice reform, improve access to better education and job opportunities, reduce healthcare costs, and designate Juneteenth as a national holiday. So some people up in arms about that because they're like, whoa, what's up with Ice Cube helping out the Republican Party and President Trump, right? You get what I'm saying about this? Like this one, Deontay Johnson says, so Ice Cube has officially given the Trump campaign permission to reveal that he has been helping us develop President Trump's groundbreaking Black Trump platform, the Platinum Plan. Leader's going to lead, haters going to hate. Thank you for leading, at Katrina Pearson. Because Katrina Pearson says, shout out to Ice Cube for his willingness to step up and work with real Donald Trump administration to help develop the Platinum Plan. You understand? So at first, okay, so this is like, and I get it because it's a very skewed statement out there, right? Very skewed, like, oh, he helped us, and now we've included it, right, Jesse? That's kind of what you're saying, right? That's why people are getting really up in arms.
Pretty much. It's just like, apparently you can't be Black and go for and help Republicans. That's what I'm taking from it.
Well, and no truth to the rumor, there are quite a few, and I know quite a few African American Republicans. Mm-hmm. Okay, it's a fact. It's just a fact. But this is interesting because I feel Ice Cube's kind of getting the raw end of the stick because he had to put out this, and I love him for this. I love this guy. He says, facts, he tweeted out, right? Mm-hmm. I put out the CWBA. Both parties contacted me. Democrat or Dems, he said, Dems said we'll address the CWBA after the election. Trump campaign made some adjustments to their plan after talking to us about the CWBA. You understand? He's like, whoa. Hold up. There's two parties that came to me on this plan. Mm-hmm. One said they'd had to wait, because honestly, they do have to wait, right? Because they're thinking, well, we're hoping. Biden just tweeted out today. He kind of agreed with me, actually. I'm just going to go on record saying I'm the one that talked about the Senate needing, like, kind of put in a bunch of independents. But he said we got to change it over because they haven't done anything about the stimulus plan, right? Which I agree with that. But he tweeted that today. I'm just saying I talked about that yesterday. So technically, if anybody's watching, I beat him to it. But what? I feel like I need to do that because then people will be like, "Oh yeah, you follow it." No, I said it yesterday's show. Come on, I made a big deal about it. The artist actor has made a number of controversial comments suggesting he was unwilling to vote for the Democratic ticket. Throughout the 2020 race, Cube consistently called on both parties to explain how they will help Black Americans. Hey, I'm all there for you. 100%. What have I said here on this show? We need people like that.
Mm-hmm.
We need people to step up and say, look, I can get along with either one of you. Just somebody do the right thing, right?
Yep.
He also called on politicians to sign his contract with Black America, which laid out a number of commitments related to prison reform, bank lending, and more. He actually tweeted out, seriously, follow Ice Cube on Twitter, the contract. He said, this is an updated version of a contract with Black America. We've been working with a lot of experts. Smart man. Doesn't have to be president to be smart. Get all the experts in the same room. Got a lot of money, has the ability to do that. Reach out to the leaders in each and every community and or smarter people than yourself, right? Ice Cube's a smart guy, but he he's smart for delegating. That's what a president needs to do. Shoot, I would vote for Ice Cube. Why not? Or someone like him. Let's see. The document is much stronger, much more detailed. We will continue towards perfection. Now, this is an interesting statement that he made, and I think it's 100% true. Okay, it's 100% true, and people don't want to hear it. So this is the all the truth, nothing but the truth. In other words, don't believe the headlines until you read the whole truth. One fan's criticism, which got a retweet with comment from Cube, began, "My hip hop hero Ice Cube's working with the dark side. I haven't felt this low since Kobe passed." Wow. Ouch. Ooh. And I get it. I've been on the receiving end of certain tweets of people that only see one side of the story versus two. That's why I always say, wait till the second side comes out. So Cube weighed in. This is what he said. You ready?
Yep.
Every side is the dark side for us here in America. They're all the same until something changes for us. They all lie, they all cheat, but we can't afford not to negotiate with whoever is in power, or our condition in this country will never change. Our justice is bipartisan. Dude, that's some heavy stuff. Because he's right. He's 100% right. You got dark on both sides of the aisle. You understand? He's not wrong. But what do? Right? You're in a situation. You got cops all around you. Whoa. What are we going to do here? Whoa. Let's think positive, people. What's going on? Oh, we got a call that, we saw an armed robber. You fit the description. Whoa. I'm not the one you're looking for. Well, what are you going to do? You can't fight back. Okay. Look, lock me up. Innocent to proven guilty, right? The article goes on to say, on October 11th, the 51 people are wondering what does that have to do with anything? Because even though you have, let's throw that out there just really quick, okay? Let's say you have policemen of different shades of color. All right. But in among like 50 of them that all have their, okay, let me share this story. Okay, this is an interesting story. I one time was I used to do security systems. Okay, Jesse, and I would help people out, businesses with them out. So I was on one consulting job, and it was a restaurant. Okay, it was a restaurant, and I checked out the system, the current one that they had. They had a panic button underneath the like hostess area, right? I checked it out. I kind of looked at it. I don't know if I touched it accidentally because I didn't think I did. And about 15 to 20 minutes later, they get a call. And the call was this: "Are you okay? Is everybody okay? We got a call from a panic button." And that was to the owner. The owner's like, "Yeah, no, everything's cool." They said, "Well, we need to be able to come in and check." I was like, what just happened? Kid you not, Jesse. I looked outside. There were cops with their guns drawn on the restaurant and me inside. I felt this big. I felt so tiny. But I was like, oh, I'm so sorry. Because they get charged for that, by the way. I'm so sorry. I will comp you. And like, you need a new security system because that one's way too sensitive. I didn't even touch it. I think I brain done it. I kid you not, Jesse. I was like, oh man. And thankfully, the police officer came through, checked it out, checked my badge, made sure. I'm like, look, I work with ADT. I'm so sorry that we were testing the system. Evidently it went off. I had no idea. I apologize. We're trying to replace it. He's like, oh, okay. Well, don't let it happen again. He was very upset because that was time away from something I didn't mean it, but it happened.
Yeah, it does.
Now, thankfully, I didn't go outside and there was somebody that was like very, throw caution to the wind. Let's shoot the guy, right? I might have gone out with my bag like, oh, they didn't want my security system, and then, right in the head. So my point is this: don't automatically decide for yourself like this particular person. Don't be that guy to kind of shoot a shot across the bow, and you're all of a sudden on the right side when you're on the wrong side because you don't have all the facts. Ice Cube's just trying to do what Look, Martin Luther King had to work with whoever would listen to him and go against the majority of people that would go against him as well. Mm-hmm. He was, in the end, more popular than not, but what happened to him, right? He tried to work with all sides of the table. Don't believe me? Trust me. He would just, if he could sit down with anybody and talk some reason, most thought leaders do that. You can't be like, oh man, you just totally, messed with us. So Ice Cube, I applaud you for trying to do the right thing. Done. And speaking for the community at large, look, I can't speak for the community. I don't know the little goings-ons of the community as much as Ice Cube does. I'm not the one going to be like, oh, I know what your life is like. I don't. If Ice Cube had pushed the panic button and he had gone outside, what would have happened? Down on the floor. Most likely. Agree, disagree? I don't know. I get it. I might be Latino, but a lot of people are like, wait, what are you? Right? Unless I say my name, then they're like, oh, okay. Right? I had one person say, you don't look like an average Mexican. I'm like, well, what does an average Mexican look like? People, seriously. So there it is. Look, I'm going to be the first one to say, oftentimes I don't get the type of treatment most Latinos get, by the way, just because of my lighter skin and or complexion or whatever you want to call it. All right. So there it is, people. All right. We got to take a quick break. We'll be back with more right after these messages with more, including comments coming up next. Hey, Jesse, quick question. I don't know. Hold on. Let me see if your audio is going on. Check. Oh, yeah. My audio is going out still. It still doesn't mute it. Oh, well. Was there a call for me or?
That was actually Cynthia Fisher.
Calling early? Wasn't she at 8:10 or 8:30?
She said that it was at 11:10 or 8:10, but I told her I was told it was 8:30.
Yeah,
so
I have it
back.
I have it here at 8:30.
Said she'll call back.
Okay, cool. Unless I messed up again, but I'm pretty sure I didn't. Hold on, let me check.
It's okay, you can blame Mercury now.
I have a thing about when I'm wrong, I'm wrong. I like to admit it, but when I'm right, man, am I right? Yeah, 8:30. It says it here. Okay, good. Yeah, I was right. All right, let's go back here. That's right. I know you guys can hear me. It's a thing with me. I get peeved, okay? Because if I'm wrong, I will admit it. But if I'm right, ooh, you better not be on the receiving end of that, right? What? It's a thing. But I'm the first one to admit it. Don't I, Jesse? I admit it all the time when I'm wrong.
Oh, yeah, you do all the time.
So I before I get called out, no, you were wrong. I'm like, check out the email. I was right. Oh, okay. Good. And then I expect an apology. Because if I'm willing to give an apology, I expect an apology, right?
Yeah.
I'm that person. I'm sorry. I can be a little, I know. I'm working on it, okay? Not everybody needs to say they're sorry. Actually, I disagree with that. If you're willing to say, I once taught a little 7-year-old to say, I'm sorry, because he had a problem saying, I'm sorry. I said, you know what? Sometimes a lot of things can just be, when you acknowledge that you're sorry, it's amazing what that could do for you and or the other person, right? It makes you less prideful. Well, I didn't talk to him about pride. I just, had to put it in kid terms. But it does. It makes you less prideful, less egotistical, and allows you to say, I wasn't right. I'm sorry, I was wrong. And it allows the other person to say, well, thank you. I kind of needed to hear that, right?
It's a hard thing for people to do, though.
It is. It
It's hard.
is. It's very difficult. But at the end of the day, that little 7-year-old said, I'm sorry. It was so cute. All right. Anyway, don't make me tear up. Miss that guy. All right. Let's focus.
20 seconds.
Thank you so much. All right. Big shout out to Stephanie Reed. Says, hello, happy editing and script writing this glorious day for today's awesome day ahead. I love that. We're going to start off with your comment. Anybody else give a good comment or share something good?
5 seconds.
That's right. It's the morning show right here on ABC News Radio, KMET, 1490 AM. Joining our live streaming audience, Facebook, Instagram, YouTube, of course, Periscope TV and Apple TV, LinkedIn as well. We're checking out the comments right now. Stephanie Reed over there from Cleveland, Ohio says, hello, happy editing and script writing this glorious day for today's awesome day ahead. Stephanie always has a very positive spin on things. It could be like super cold. She's like, this is an awesome cold day. It could be super hot. She's like, this is awesome hot day. It just I love her positivity there each and every day. So keep it up, Stephanie from Cleveland, Ohio. Katya Wunderland tuning in from Switzerland says, hello, everyone. Appreciate you. Well, I added the appreciate you thing. There you go. Rosalie Huerta says this, good morning, folks. Good morning. Let's see. We've also got Diana Carbajal says, good morning, Breakfast Club, Aaron and Jesse. Yeah. The online audience refers to themselves as the Breakfast Club, just so you know. And I love it because oftentimes I wonder, what are they eating during the breakfast, right? But some are not Breakfast Club. Some are afternoon members. We've got a couple of viewers from like Scotland. So I almost want to call it the Daily Show, right? But I don't want to be confused with Jon Stewart's Daily Show. You ever watch that, Jesse? It's a fun show.
I'm gonna say yeah, but no.
Well, I mean, Jon Stewart doesn't do it anymore. I kind of wish they'd bring him back, but I have no problem with the new guy. He's cool too. We've had him on the show. We've interviewed him. Let's see. Hyacinth says this. Hello, welcome, good afternoon. I love you. I love you too much for new would of God, please. I'm not. I'm not sure what country, but Hyacinth, thank you for tuning in. Appreciate you. So there we go. Let's see. And then Diana says this, strong statement for Ice Cube. So true, right? Thank you for sharing that too, by the way. It's true. If you're just joining us, we talked about Ice Cube doing the right thing. And as much as possible, he actually got a lot of pushback. Let me give you a little bit more information on this, by the way. He said this in a video. Okay. He went on to say he had been in contact with both Democratic and Republican leaders. And he emphasized he did not trust any of them, right? I get it. You got to work sometimes with people that are nefariously in it for themselves. But you go, look, people, how are we going to get change done? So he says this in a video, all right? Which I actually appreciate. He says, no president has done right by us. So I don't trust none of them. Putting our hopes and dreams behind any of them just don't work. Wow, that's some strong statement. I mean, when you think about that, he's not entirely wrong. Sometimes they get promises all the time and none of it comes out on the right side of things. He says, straight up, I believe the Democrats have been nice. I don't really see them pushing their policies in any different direction. He added, Democrats recruited every black celebrity and bleeped on them. Yeah. So they just figured tell Cube to shut the bleepity bleep and vote. I ain't going to do that. I'm going to push the program. He continued, quote, we also met with the Republicans. They've moved their agenda a lot because of what we've said. They put $500 billion on the table, but who knows what's really going to happen. See, I like him because sometimes there are promises made. Oh, we're going to do this. We're going to do that. We're going to do this. And then 2-3 years later, the committee's like, you guys did none of that. You just talked about it. Says, I just know one of them is going to win, and I don't know if it really matters to us. So, again, if you're just joining us, news of Cube's alleged involvement in the Platinum Plan immediately sparked criticism. Many labeled the entertainer a sellout, a manipulator. Some Twitter users slammed him for not being completely transparent about his work with the Trump administration and claimed his previous comments gave the false impression he was unwilling to support either party. But you know what I say? You should be willing to support any party. You just be like, look, you do the right thing. You prove it through actions. You don't just talk about it. There's one thing talking about it, and then everybody goes, 2-3 years later, you go, well, how much of the promises did you actually keep? To which I would like to see a little synopsis on each and every president. How many of the promises did they keep in the campaign that they actually pushed forward, right? And some are like, well, we couldn't do it because it was an uphill battle. But next time, hey, you make a promise, you try to keep it, right? All right, people. Speaking of promises that I hope they'd keep, President Trump made a promise about price transparency. One company, very, very happy about it. We'll talk about that next here on The Morning Show. Stay tuned. All right, I take it our next guest is ready to go.
Yes, ready to go.
Awesome. Good to have her back. Cynthia Fisher, everybody. Go check it out. Patientrightsadvocate.org. Leaders on the forefront of patient rights advocacy speak about COVID-19 testing and treatment billing issues and the healthcare billing system in need of reform. And this has been going on for a couple of weeks. Actually, we meant to have her on last week, but there was a scheduling error on my part. But we got her back. So I'm happy to say we could tackle this discussion. And you can follow them on Twitter, PT Rights Advoc, which just tweeted us out. Thank you, by the way. And it is being fought by the American Hospital Association in the courts. So there's a lot of back and forth happening behind the scenes, trying to make this a reality, by the way. So be an interesting discussion. If you have questions, please do share them in social media. Let's see, Judy Munoz. Appreciate Judy. Judy always shares our Facebook feeds into other groups, getting us a lot more views and more fans. Thank you. Let's see. Maria over there from Canada says, good morning. Love Canada. Seriously, I can't wait to go to Canada one of these days, Jesse.
Right? That'd be awesome.
I know. I've always wanted to visit Vancouver. And not going to lie, I appreciate their healthcare plan. I know you pay a lot in taxes. I get that. Most places like that you do. I've heard good and bad things from Canadians, by the way, but the majority of it is good. More good than bad. Which is why I never hear of too many Canadians that upset and mad and angry as much as I do the average American. You know what I mean?
Yeah.
But then people are like, well, you can't go through that because then that's a different type of and I'm like, well, can't you learn from it? Kind of, sort of. I mean, but then people are like, well, then you got to pay more taxes. Well, I mean, it's a catch-22. Where's the money come from? How are they going to do this? Blah, blah, blah. Right now, the American person usually takes out of their own pocket, on average,
20 seconds.
I don't know how much. Maybe Patient Rights knows this. I don't know. We'll see what we get and information. Here we go. Thank you, Jesse.
5 seconds.
Welcome back. Yes, it is the morning show right here on ABC News Radio, KMET 1490 AM. Joining our live streaming audience there, Facebook, Instagram, YouTube Live, Twitter's very own Periscope TV, and of course, LinkedIn. Glad to have you with us. Don't forget, you can also download our app. It is free. KMET1490am.com. Free and ready for you to use at a moment's notice, no matter where you're tuning in from. If you're in the vehicle and you're going to work and you're like, you know what? I don't want to not stop listening to this amazing show or any of our great programming. Right now, in the midst of this pandemic, patientrightsadvocate.org, which is a nonpartisan, nonprofit 501c3, provides a voice for consumers, patients, employees, employers, and taxpayers to have transparency in healthcare. The organization is here with us. Speaking for the organization is Cynthia. Cynthia, good morning. Welcome back to the show.
Good morning, Aaron. It's a pleasure to be here. And it's Cynthia Fisher, and I founded patientrightsadvocate.org to bring the voice of the American consumer to Washington. And the beauty is that I can applaud President Trump and the President Trump's administration for actually delivering on unleashing a free market that all Americans, as of January 1st, 2021, are going to be able to see prices from hospitals and then subsequently insurance companies, so that we'll get to know the discounted cash price. What's the cash price if we pay cash? And what's the negotiated rates of not only our own insurance coverage, if we have insurance, but how does that compare to what the same company applies for any other company or other plan? So we'll be able to see and shop with not only our computers and shop online before we get care to have this information, but then excitingly, we'll be able to shop with our feet to drive down the cost of not only care, but also insurance coverage. This is huge. This is absolutely a huge win for the American people. And it doesn't get much news coverage. And I'm thrilled to tell you that President Trump listened to the patient stories that are on our website, patientrightsadvocate.org, and he invited them into the White House and employers and taxpayers to tell us their plight. Because today we've been blind to no prices. We've been blindsided with outrageous medical bills we never knew we'd have to pay. And then before we even get our care, we have to sign with a blank check that will be responsible for whatever they choose to charge us. Well, it's game over, hospitals and insurance company and pharma. You got to show your prices as of January. This is huge, and I'm so thrilled to share it with you.
Well, and I'm glad you're bringing this up. I know we had you on a while back talking about this on the show. And in reality, whoever will listen and do the right thing, I think you'd be for, right?
That's right. And, let's look at it this way. This is a legacy for not only the individuals of today, but for our own families and our future. Think about it. So much of our wages today go to our health care benefits. And we've seen double-digit runaway increases every gosh darn year, especially for small and medium-sized businesses' health plans. And for workers, our deductibles have gone to the moon. In fact, most average families have at least a $2,000 deductible of out-of-pocket costs. Well, we can put all of these trends in the reverse as soon as we can see prices and we're empowered and have the freedom to be in control not only of our health decisions, but to be in charge of how we choose to spend our money.
So I have a question for those, of course, voters out there that are trying to make the right decision on what to do, when to do, how to do it. Obviously, there's always fact checking involved, and just to lay down some facts, regardless of whether the President Trump wins or loses, this is already going to happen as of January 1st, or is it contingent upon him winning?
Well, right now, Aaron, as we speak, when President Trump wins this election, I mean, think about it. This is something that he will continue to fight for in January. This is done through an executive order and through rulemaking. And I think what's a little scary, Aaron, is we're bipartisan. This is a 90% issue on the polling from Harvard-Harris poll. And
sure.
90% of Americans, bipartisan, want price transparency and want control of the shop.
Sure.
They want free market. Now, we have not had one Democrat sign on to the Healthcare Price Transparency Act of the Senate, trying to put what President Trump has done through executive order into permanent law. Not one.
Can I ask you what your perspective is on why they haven't, just out of curiosity?
I'll just tell you, Aaron, I think it's pretty simple. I've heard it from Schumer himself. They don't want to give Trump a win. And, a lot of these folks are concerned about campaign money on both sides of the aisle.
It's true.
Getting the healthcare insurance industry, the hospitals, the pharma, make up 20% of our economy right now. And the lobbyists and lawyers have aligned Washington. In fact, just now, as you're on this radio show in another room, I was listening to the court case, because as soon as the president issued these rules, in June of 2019, the hospitals sued with their lobbying organizations, and they sued to not show their prices and keep us in the dark. Well, guess what? They lost in the courts, and our organization supported consumers wanting to be informed. So we wrote the amicus brief. Right now, they lost in the courts. The court said in favor 100% of the consumer being informed. And then guess what they did? The hospitals sued again to go into the appellate court. And right now is the hearing in the appellate court where they're trying to not show their prices. So this is a fight that's going to continue on. But as of January 1, it is highly, highly likely that we will start to see prices, and that will be a legacy. But we still need the president to keep fighting it because no Democrat has signed on. We have not seen Biden, nor Pelosi, nor Schumer sign on. And, you know, what they want is big government, and they want more opacity to stay status quo because big government currently controls our healthcare decisions, and they control to oversee our health decisions and overspend Americans' money. And this needs to stop.
So Cynthia, let me ask you something, because I would hate for somebody to think, again, you're a nonprofit, you say you're bipartisan, but let's just throw no caution to the wind and just can I have you at least admit that if the Democrats also said, if Biden's team said, you know what, we love what you're doing, we're going to adopt that as well. If we do win, would you be just as happy for the Democratic side if they said they were going to make it win, or would you be still pro-Trump?
I'll be absolutely happy no matter who takes the White House on this issue. It is of critical importance because right now our American citizens and our economy pays more than double than any other developed country, affecting our entire citizenry and affecting our employers and across the country of overpaying for healthcare. And so we're bipartisan. We support both sides. We've gone many times to both sides of the aisle, and we've only gotten Republican support so far. But this is a 90% issue for all Americans, and it's a huge opportunity for the Democrats. It's a huge opportunity for Biden to sign on to price transparency, right. Schumer. But they haven't yet. We haven't heard it yet at all. Hey. But let me tell you, I think they're going to have to, Aaron. And you know why? Another remarkable thing happened today. And that is, I believe very firmly that we have crossed the chasm. IBM and that's the International Business Machines, the technology company, and KPMG, which is the huge accounting firm, both today announced that they are totally going to support price transparency, both in their technology platforms and in their software and in their consulting businesses to make hospitals and insurance companies have platforms to show their prices. So the fact that industry has stepped up and Walmart has stepped in to broker insurance, and also they basically started integrated health clinics in Georgia that they're going to roll across the country that are totally price transparent. You can go online today and look at Walmart in Georgia and see that an x-ray is $10, a strep test $20, a doctor's visit $40. It's all price transparent. And that is the future. Industry has stepped in. So I think today, as of today, I'm so thrilled to be on your show. We crossed the chasm. So no matter what happens politically, I think the industry has stepped up to say it's the right thing. And independent, if Washington isn't getting it done in Congress, business is going to get it done.
I'm so glad you brought that up because I always say, look, both sides of the aisle need to do the right thing. Ice Cube, you're kind of reminding me of Ice Cube. I don't know if you know the situation with Ice Cube. Ice Cube, threw out a plan for African Americans, for the communities to be taken care of. Lots of money being reallocated. $500 billion was a proposal that he came up with, and he pitched both sides of the table, by the way. And back to something you did say, which I'm 100% on the same page. Whoever does it right and does it and sticks to that, doesn't just make promises, but sticks to their promises and delivers, you got my vote.
Well, thank you. And, we've gone to both sides of the aisle. Schumer knows it. I met him 3 times in person and once on Zoom. We spent an hour the last time together on Zoom. And, I get on his case. I said, Chuck, you need to sign on, and you've had your Democrat senators stand down. This is a bipartisan issue. This is for the 99%, right? This should be a Democrat issue. But independent of this, it's going to be industry that's going to, Congress is at loggerheads, right? They're just playing politics. And so right now, as we go into 2021, The revolution in healthcare will already begin, and it's going to be industry that's going to get it done. It's not going to be policy in Washington, but I will say that President Trump is a businessman, and gosh darn it, the Trump administration listened. The fact that I can tell you that we had many, many meetings at the White House bringing in actual patients from around the country, bringing in actual business owners and doctors and providers that went price transparent and have showed the solution and are already realizing that when they contract with price transparent docs and surgeons for their care, they're saving 30 to 50% than what they previously paid. This can happen for all Americans. I think it's going to be the business economy, the tech sector. The tech sector is going to step in and shake up the greed and shake up the opportunity of waste, overpricing, overcharging that the healthcare industry has gotten away with way too long.
Well, Cynthia, again, if you're just joining us, we're talking to patientrightsadvocate.org, which is a 501c3 nonprofit, nonpartisan organization that provides a voice for consumers, patients, employees, employers, and taxpayers to have transparency in healthcare. Obviously, this is also a big win for you because you've been at this fight for how long?
3 years. 3 years. And it's been nonstop. And you know what? The beauty is we just brought the American voices forward who didn't have a seat at the table. And, I'm so excited today, Aaron, because with IBM and KPMG's announcements of supporting price transparency and putting a technology platform and consulting forward, we have crossed the chasm to unleash a real, functional, competitive marketplace in healthcare. And we're going to be able to shop for our MRIs and our colonoscopies and our breast cancer treatment or prostate cancer treatment, just like we do for groceries and airline tickets and everything else we do in our economy.
Well, I am glad you're bringing this up. The healthcare community really needs a lot of revampment. There are so many what I call, like the frontline workers are the ones that kind of get hit heavy, but oftentimes every now and then their hands are tied based on what I call the financials of it all. Does that make sense?
Absolutely. And they don't even know how much they're getting taken advantage of. The American worker, the American taxpayer is being so taken advantage of. These hospitals, not only are they suing the Trump administration right now to keep customers and clients and patients in the dark, which is ridiculous. But they've all through this pandemic, we've had patients go on our website and on the air saying they've had a $10,500 COVID test, a nasal swab, in a tent outside of an emergency room that they thought was free. When they say the test was free from the government, they give them a credit for $35. I mean, we see tests either for free or for $100 to $10,000. It's ridiculous. And during this COVID crisis, hospitals have continued to sue patients for balance bills and egregious upcharging that they've done that have given patients no recourse. And every day in court is a $75 court fee, and every piece of that fragmented bill is a separate day in court. So $14 an hour, $7 an hour workers end up in court every piece of every fragmented bill. And when they're blindsided, they have no recourse, they have no representation. And this needs to end. And so the Trump administration even is putting a wall of shame, which will be posted on the government's website, and the hospitals will have to show whether they sue patients or not for these egregious bills. But all of this will go away because when the consumers can see before they get care the price gouging and the overcharging, the waste and the fraud, well, that'll just shut it down, and the consumer will be empowered. So this is a new world. And I'm so excited, Aaron, to be on your show today because I jumped for joy this morning when I learned that the tech industry is now going to unravel all of this Gordian knot by transparency and putting it in our palms of our hands on our smartphones.
Well, Cynthia, again, I appreciate you because you've been fighting the fight no matter what. And this is a big day and big win for you. I got to ask, though, what further needs to be done in your line of sight? Because, sometimes, and I always say, be careful until it actually becomes a matter of fact, because things sometimes have a way of not throwing out any negativity or any bad spirit out there. What I'm saying is I'm hoping everybody by January 1st, everything that you said is 100% true. We don't have this conversation of what happened, but what do you think needs to be done further to solidify this in place, no matter what?
I think one is, one is I call it the healthcare industrial cartel, right? The insurers, the hospital associations, and the lobbyists are in their swampian ways surrounding Washington to kill by delay, right? And as you said, Aaron, it's really not over until the fat lady sings. And when the fat lady sings is when you and I can pull up on our smartphones an app, just like Uber, and look at where we are, with our GPS, where we are globally positioned, right, and where can we get an MRI at the lowest cost if we can get it for $250 at a discounted cash rate. Why would we pay $2,500 in the hospital for that insured rate? And so both our coverage is going to be pressured. If our insurance plan pays $2,500, well, heck, that's going to raise my insurance coverage next year for them paying that silly 10 times overcharged price. So once we see it in the palms of our hand on our smartphones and we can shop online and we can see and price transparency will usher in quality differences, right? And just like when airlines got deregulated and we got to see prices, what happened? Flights became safer. Airline crashes went down because they didn't go down, and we actually stayed up in the air and were safer because they had to compete, and they had to compete for price and quality and safety. And that's what we're going to see in the hospitals and what we're going to see from our insurance coverage. And guess what? Innovators are going to come in and say, why do we even need coverage? Why don't we have a reimbursement at the discounted cash prices, which Dr. Larry Van Horn and Art Laffer at Vanderbilt University in Tennessee showed that the discounted cash prices across our country, which we can't see today, are generally nearly 40% lower than the lowest negotiated rate from the same facilities, from the same doctors, and the same markets. Once we see that, we'll question, why are we paying so much for insurance when they give us lousy rates? And when we as consumers are empowered, we're going to change healthcare to be affordable for all Americans.
Cynthia, thank you very much for fighting the fight there. And I do appreciate you. Look, wherever the political realm goes, I always say, do the right thing by the people, for the people, because we all, at the end of the day, are equal. But when it comes to pricing, I see so much inequality.
Yes. And you know what? I would tell your listeners, start asking for prices now. Put the pressure on now. Shop now. Ask for the discounted cash price. And you'll see a huge difference. And just start the pressure now to get that information wherever you can. And you can pay cash. Try to pay for an MRI after hours, in the wee hours at a low cash price. Many people are saying, wait a minute, I can save my money and I can push my insurer. And after the fact, you get caught in a quagmire and you can't even remedy erroneous and fraudulent bills.
I saw one time somebody admitted, and I think it was like a call that they made or some care that they got or a meal that they got. And I was like, they were charging like $85 for the meal, and the meal was like terrible.
Yeah, it's absolutely outrageous. We have one patient that just called because in Massachusetts, you have to get a doctor's authorization to get a COVID test. A young woman living in a house with a couple of folks that had COVID wanted to get a test. She was told, she called the doc. The doc said, don't get a test. You just quarantine. You're young. You're fine. We didn't have enough tests at the time. Well, guess what? She got over now $1,100 in charges from that doctor's office that outbound called her and left voicemail messages on her phone, caught her for 5 minutes. They charged her facility fees and inpatient doctor's visits by just doing outbound telemedicine to her fraudulently. And she's tried now for 6 months to get those charges dropped. All she made was an innocent call. And, she can't even go against the biggest employer in Massachusetts, Partners Healthcare System, fraudulently billed this patient, and she can't get it off of her bill. And the insurance company paid the bills, and she had out-of-pocket copays of at least $700, but the insurance paid the balance. And she went to the insurance agency and said, we have to fight this bill. And they said, well, by law, we have to pay the hospital. We can't not pay the hospital. And so right now she's in a doom loop. So this will all end when we see prices up front and we have the ability to have recourse when we've been misdiagnosed, mistreated, and mischarged.
Right there, I'm already upset. Look, there's so much fraudulent activities happening behind the scenes that need to be brought to the forefront. But you know what? Look, keep doing what you're doing. PatientRightsAdvocate.org is where it's at. Cynthia, thank you for spending time with us here on the morning show. I kind of wish we had another half hour with you because I want to ask, maybe we can have you back to talk more about those stories that are happening that, you know, need to be corrected right here, right now. Because I feel that once it gets into the public sphere of influence, people go, what? There's so many insurance companies that do things behind the scenes that, you know, if you speak out about it, you suddenly get sued for, you know, whatever they want to call it. I remember I had one advocacy group talk about what Cigna was doing. They're like, well, we're going through a battle and we can't talk about it, but we talked off camera, and the stuff that I heard, I was like, oh my goodness, but I didn't want to get sued for pushing out information that could be, like, you know, misconstrued as, well, you didn't have all the facts. So I'm like, so sometimes my hands are tied. Does that make sense?
Absolutely. And they are tied. And, you know, all the incentive systems are upside down and backwards, Aaron. And I'd be more than happy to come back on the show and talk about that. But the insurance companies, for instance, with the Obama plan, one of the brokenness of Obamacare was they actually are limited on getting paid on a percentage of the top line revenues billed to the employer and to the patients. So the insurance company's incentive is to pay as high as a rate as possible because they get a percentage of that rate. So how does that drive down our costs? So the only way we can change this is to get this craziness shown through sunlight and transparency, and empower the consumer to drive down their costs through having many choices of where they get care, knowing what they're going to get at what price, but also looking at their insurance coverage and holding their coverage negotiated rates accountable for not doing and serving them well. So this is a huge change. And just look at the stock prices of United Healthcare, Cigna, Aetna, and the mergers in the industry that have consolidated monopolistic practices, and the stock prices and the company values of the insurance companies have grown enormously. I think they've nearly doubled in the past decade. We could look at that the next time and look at those exact numbers.
Yeah.
But,
and we're going to have to the next time because we're out of time, Cynthia. I got to let you go. We're up against the end of our show. Thank you very much for spending time with us here on the morning show.
Thank you, Aaron. And to be continued. Thank you for the opportunity.
Absolutely. Cynthia Fish, everybody. Again, great organization, really trying to fight the fight, no matter who wins at the end of the day. PatientRightsAdvocate.org are trying to do the right thing by the American people. And I think for the rest of the world, it's a good, you know, disclaimer there. Should be the leaders for the rest of the world. All right, people, we will see you tomorrow. Same place, same channel. Make it a great day. Remember, download our app. It's free. KMT 1490 AM. All right, and for the rest of you tuning in, I appreciate you. I really do. I would keep her if I could, but she connects through our radio show audience. And but look, she brought up some really interesting things, much of which I was completely unaware of, 100%. Meaning, you know, there's only so much news in the day that you can constantly be, you know, aware of. So I appreciate the stuff that she said, and you know what? I appreciate her because I get it. I would scream for joy as well if somebody listened to half of the things I say on this morning show, right? Because I keep pushing for businesses to have affordable equipment to be able to simply see from a distance, infrared cameras to see if somebody has a fever, right? Instead of, because sometimes, you know, you don't have all the manpower to go up to somebody. Let me test your, you know, I applaud the ones that do that, by the way. I've been to several businesses that are like, we won't let you in unless we test your you know, your fever-ish detail. I had one salon that I went to as of most recently had me write a kind of a disclaimer note in order for me to see this hairstylist. And at the same time, when I came to the door, I mean, they were like very adamant, you got to wear your face mask, which I already do. There was no problem there. And then they checked my temperature, right? And I'm like, okay, cool. At least I know I'm not having a fever, right? And then, you know, I was able to enter, and everybody wore their face masks internally as well in order to try to stay safe and keep safe at the same time. With that being said, The country is about to go in lockdown. I know I'm saying it right here, right now. It hasn't happened yet, but here is what I'm saying. And I didn't get a chance to talk about it on the morning show necessarily. So I'm going to share it right here, right now with all of you. If you look at world news, okay, I actually have had to look over at BBC News, which obviously is around the other side of the globe. And these are some of the things that I've been seeing as of most recently. Let me go to this story right here. New Europe restrictions imposed to fight second wave. Now, if you remember back in, I want to say April, it was being talked about that there could potentially be a second wave. Why do we say that? Well, obviously now with the cold, the flu season coming back around and or it mutating. Look, back to the Spanish flu. This is what happened with the Spanish flu. And if you did the research, Spanish flu, it wasn't the first wave that came. It was the second wave that became more deadlier and more, let's just put it this way, more people died in the second wave than they did in the first wave, okay? But back to reality. This is the statement here again from BBC, which I love looking at international news other than just ABC News because it gives you a full story of around the world. This is the latest. Health Minister Olivier Véran and the Director of the National Health Agency, Jerome Solomon, are among those whose properties were searched on Thursday. Evidently, French police have raided the homes of senior government and health officials as part of an investigation into their handling of the coronavirus pandemic. That's not what I actually clicked on. Why did it go to that? Sorry, people. It brought up something else entirely different. Or maybe they changed it. Okay, well, I'm going to read it anyway. This is interesting. The raids came after a court launched an inquiry earlier this year into the government's handling of the pandemic. It has faced criticism over shortages of equipment and slow response times. Prime Minister Jean Castex is also under investigation, French media report, as is his predecessor, Edouard Philippe, and Mr. Véran's predecessor, Agnès Buzyn. The Prime Minister and Mr. Véran have been at the forefront of France's new policy of imposing nighttime curfews in 9 cities, including Paris, from Saturday, which will be enforced by 12,000 police. According to this, let's see, it says this means at 2100, everyone must be at home, and without exception, every place, business, or public service open to the public will be shut. Special court hears cases of alleged wrongdoing by ministers and other government officials in the course of their duties. Before the claims to be substantiated, there would have to be evidence that officials knowingly failed to take obvious steps that would have saved lives. Oh, they're going next level there. In July, the court launched the inquiry into the government's handling of the pandemic after members of the public, including doctors and relatives of victims, alleged that it had been criminally negligent in its response to COVID-19. How bad is the situation in France? A further 22,951 cases of COVID-19 were confirmed on Wednesday. They said, we have to act. We need to put a brake on the spread of the virus, Mr. Macron said in a television address. Sorry if I'm getting these names wrong. I am not French, and I just do not know how to put the correct spin on the actual way you say these names, so I apologize ahead of time. If you're French, I do apologize. I get it. You guys are upset when I speak. The president added that this wave of COVID-19 was different to the outbreak in the spring because the virus had spread to all parts of France. France managed to control the first outbreak by introducing a national lockdown. It then opened bars and restaurants in the summer and allowed foreign tourists to visit as part of an effort to boost the alien economy. Sounds like something we did here, right? I'm just saying, kind of good to learn from other countries. Schools reopened and universities began teaching in-person classes in early autumn. But since August, the number of reported cases has accelerated quickly. Wednesday was the third time in 6 days that France reported more than 20,000 new infections. Do you understand why they're upset right now? Mr. Macron said the new measures aim to reduce daily cases to around 3,000. As with the first wave of COVID-19, the proof is in the pudding here. And I always say, remember, back in March, who had it harder before us? Wasn't it the European countries closer to China? Just saying, where did it get released first? Get it? And then went westward. As with the first wave of COVID-19, there is concern that hospitals and intensive care units will become overwhelmed with patients. Yikes. Isn't that what I keep saying? Hello, think about the hospitals. How many people do we have in the healthcare facility? The curfew from 21 to 6 o'clock a.m. will apply for at least 4 weeks to Paris and its suburbs, as well as Marseille. I'm not going to, I don't know the country names. I'm really bad with these cities. Affecting around 22 million people, it will be applied for 4 weeks to begin with, and Mr. Macron's government will seek to extend it to 6. The measures will stop people visiting restaurants and private homes during the evening and nighttime. Private parties will be banned. I'm telling you, you guys are upset about here at the home front, them making statements. This is not an isolated event, people. It is around the world, or at least in France. Even in areas not under curfew from midnight on Friday. All right. That hasn't happened here, okay? But it's happening in France. So much so that they're actually looking into people to lock them up for doing the wrong thing. Ouch. Residents will need a valid reason to be outside their homes during the hours of curfew. President Macron said on Wednesday night he understood a curfew was a hard thing to ask people to do. On Thursday, Mr. Castex said travel during hours of curfew was permitted for trips to the hospital or pharmacy or if work hours required. That's the same way we were back in April. Do you remember that? We had a lot of these statements, by the way. If you went out on the road, you saw it practically empty. It was weird. But a special certificate would need to be produced as proof. Pre-booked tickets for planes and trains that arrive after the curfew will be allowed. Anyone found breaking the curfew will be fined. That's 135 pounds. Businesses that suffer financially due to the new measures will be eligible for state aid. Thank God they're doing something about that. Any company with up to 50 staff in the 9 cities affected will be eligible for help if their turnover has fallen by over half in the past year. Yeah, that's like all of them. Hello. All companies in curfew areas will be asked to move towards having employees work from home for at least part of the week and to stagger working hours. President Macron has already suggested teleworking for 2 or 3 days a week. The president said, "We're in the second wave." Granted, that's not our president. That's European president, just for those of you keeping track there in France. For many people, his address will have sounded distressingly similar to what he had to say at the start of wave 1. Situation dire, hospitals under threat, public failing to get it. Action. Of course, there are huge differences. Today, we know so much more. We wear masks, get tested, doctors have better treatments. Another national lockdown like the one in March has been ruled out. But suddenly it feels like we're back where we began. In March, we are warned of a virus that has become rampant and can only be stopped with drastic action. Just as in March, we're told the health system risks being swamped. People will accept the curfew. What choice do they have? It feels like the start of a long, miserable winter. This is, again, the BBC. This is not ABC. This is not CBS. This is not local U.S. news. This is European news, people. And what have I always said? If you've been here on the morning show for any length of time, you know I always say we have something to learn on the other side of the world. I always said this back in March. If you look back at any one of the shows I ever did, I said, look, people, I get it. Because I'd get in my ear oftentimes from the TV station owner. Why are you talking about Florida? Why are you talking about New York? We're in California. Because we have something to learn about that, is what I always said. Back to European countries. When it happens in Europe, boy, oh boy, do you see the waves starting to happen slowly over here? And I said that way back when. I said, you got to see, it's called travel. A lot of European countries get visited more than U.S. American countries. Don't believe me, look it up. It's very interesting. Paris, France, and European, are beautiful places to go and visit, no matter who you are. Asian community, love to visit Europe, right? Don't believe me? Ask a European, right? It's not just all Americans. Seriously, get out of your own bubble, people. But my point is this. If we're starting to see this in France and other Europe countries are taking heed to this, that's not the first article that I found just most recently as of today. I found a lot more. Let's go to this one. Schools to close in Northern Ireland. Okay. Again, this is not, look, I always tell people this. They never listen to me. So I hope you're listening and I hope you listen really well. Be prepared for it to happen once again here. Remember what happened in March. People went kind of crazy, did they not? Toilet paper sold out, water started to have to put limits on certain things. Now we've kind of eased that. So I say this, ahead of it, go get some additional water, get some additional supplies, just be ahead of it. Back then in March, I actually posted on social media, hey, go get it. I said it 2 weeks before people went crazy. And those that stocked up on the water were happy, right? Those that listen, I don't know how many listen, but I know we did. We were ahead of the curve. So be ahead of the curve here, okay? Look at international news and say thank you at the end of the day. Here's the article headline. Schools to close and tight new hospitality rules in Northern Ireland. By the way, this is, again, BBC News, which I have a friend over there at BBC. Big shout out to Liz over there at BBC. Schools will close from Monday, and pubs and restaurants face new restrictions from Friday evening in a bid to stem cases of COVID-19. First Minister Arlene Foster has said the moves are among new restrictions being imposed by the executive. It comes as NI's Department of Health recorded a further 1,270 cases and 4 more deaths with COVID-19 on Wednesday. Big spikes, people. We went from France to Northern Ireland. Oh, that's what NI is. Northern Ireland. Got it. Northern Ireland's Department of Health. Got it. Okay, see, I'm a little slow on the uptake. Hospitality businesses will be limited to takeaway and delivery services for 4 weeks from Friday. Well, that's kind of what we have already here, so we're ahead of the curve there. Health officials had warned infections would rise further if both schools and hospitality premises remained open. Hello? How many times have I said this, people? Be careful about letting the kids go back to school. How many times have I said that? Especially the youngest ones, right? So now all the information's out. We're like, oh no. Northern Ireland's health department has now recorded 23,115 cases since the pandemic began, a quarter of which have been reported in the past week. A quarter. Do you see the need for them to say, oh, shoot, we need to put everything back on lockdown? Back to the hospital systems being overrun. The executive has agreed schools will close for 2 weeks, including the half-term holiday. I think it's going to be longer, people. That's called. Let's go back to right. That's the way it was for us in March. Remember that mid-March, early April. Remember that until the president started saying, "Hey, everybody, it's okay." By spring, we're gonna be. What did you say? I'm not gonna quote him because I'll probably misquote him. Let's see. He said lengthening the Halloween midterm break by a further week of holiday represented a compromise position within the Stormont executive. You see, they appreciate Halloween too. You're not the only ones in the United States of America. The minister said there had been little evidence that schools were significantly contributing to rising COVID-19 numbers. Hello. I wish I'd watched the morning show. I talked about that back in March. I hate to be right. I really do. Let's see. I can't pronounce this guy's name. Sin finds Connor Murphy said his party would have been prepared to back a longer closure, but they were content with the decision. Mrs. Foster outlined the changes in a statement to assembly members. They got their own people to have to overcome. Further guidance is being issued that will also advise against unnecessary travel. The executive will meet on Thursday to discuss further support packages for businesses concerned about what closures will mean for jobs and viability. Talks ran into the early hours of Wednesday as ministers tried to reach a compromise on a range of decisions, finally agreeing to impose the following measures for 4 weeks from Friday. Now, again, people, this is Ireland, Northern Ireland, okay? Now you're in the States, but, very interesting. If it happens in other countries, almost guaranteed, a semblance of this is going to happen here, whether the president wants to or not. Just saying. Here we go. Closure of the hospitality sector apart from deliveries and takeaways. Other fast food and takeaway premises to close at 2,300 hours that they do that, I always have to convert that. I'm like, what's 2,300 hours? Oh, that's right, 11 o'clock. Or is it 10 o'clock? I don't know. 24 hours. So confusing for me. Off licenses in supermarkets not to sell alcohol after 20. Does anybody know the time change? Can somebody look that up? No indoor sport or organized contact sport involving mixing of households other than at elite level. That's the thing. Are you elite? I'm elite. You're not, but I am. Actually, it's an Ireland accent, so I don't know why I threw that accent in there. I like that accent. I don't try to do Ireland. That'd be Lucky James. No mass events involving more than 15 people, except for allowed outdoor sporting events where the relevant number for that will continue to apply. I am the elite, not you. Somebody say that's a terrible Ireland impression. You know what? It's a Lucky Charm impression. You're welcome. Close contact services such as hairdressers and beauticians to close. Ooh, that's what I foresee happening here, by the way, folks. We're going to go back to that unless we figure out how to do it right. We could be ahead of the game there. Just make certain mandatory things mandatory, like checking up temperatures. They even have little strips that I've been reading that like can test for coronavirus. I don't know how fast those are or how reliable they are. I'm seeing some pushback because some are saying they're not that reliable. They're somewhat reliable, blah, blah, blah. I say something better than nothing. Close contact services. Oh, I already read that. Mobile hairdressers and makeup artists also classed as close contact services prohibited from working in homes. But what about outside? Do the outside route then. Make them go out. Oh, yeah, that's right. In certain areas of the country, it's actually very cold. Get it. Got it. Good. Gonna need a lot of those heat lamps. Gyms to remain open for individual training, but no classes permitted. I'm confused on that one, but okay. Places of worship to remain open, but face coverings mandatory when entering and exiting. Really confused on that one, but okay. While there was no specific mention of hotels, it's understood they will also be closing for 4 weeks. You can't stay in a hotel. What about a motel? While there was no specific mention of hotels, it is understood that they. There it is. Okay, blah 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 blah. Let's scroll down. So there's a lot of like do's and do nots. Seriously, if you're in Ireland, I can guarantee you this: you are super upset and mad and angry at either everybody or then some. I'm going to show you guys what they are seeing right here, right now. Okay, just to give some perspective. Let me see. How do I do this again? Give me a moment. I'm going to try to share my screen. So you can see, I'm not making this stuff up, people. I think it's this one. There it is. Okay, UK coronavirus hotspots. Let's see, tap or click to see how many cases per 100,000 in the last week. Oh, let me bring it up. That would be helpful. Did I bring it up? Hold on. Yeah, there it is. Okay. I'm going to bring up full screen for you guys. Okay. So there you go. Zoom that in if you have to. Let me click on it just so you can get an understanding here. Okay. National public health bodies map made with Cardo. All right. So you see that there. See where Ireland, see Northern Ireland. You see the 200 plus number there? That's a problem. And for those of you that don't know where Ireland is next to the United Kingdom or London, I can't fault you. I didn't either. Okay, so there you go. So there's the map. All right, we're all a little bit smarter for having, but you see how this is so important, why reporting is so important. Look at London. London's pretty good over here, right? I don't know if you can you guys see my cursor pointing to it, or does it not show my cursor? I never tried that out. Does it show my cursor? I don't know. I've never done that before. Okay, anyway, long story short, you see the bottom. Okay, 200 plus. You don't want to be in the, what is that, like tan, orangey section. You want to be, hopefully, in the light blue. All right? So if you're in the blue, you're okay. 10 and 24. Okay, that's not bad. That's manageable. The healthcare system can manage that, right? True, pretty true. But you see a little pocket of yellow right there on next to London on the west side there? That's not good. And here's why. Look at it coming from the northern side. Like if this were a virus, okay, the virus, the most extreme cases, the most extreme are in Northern Ireland. Do you see why they're saying, oh no, we got to nip this in the bud right now? But do you think Northern Ireland visits the United Kingdom quite optimally so, or the United Kingdom visits Northern Ireland every now and then? Who knows? But if you look at the way it's spreading out, you see in the center, almost in smack dab in the middle, above London, it's termed underneath the United Kingdom. I'm not sure what part. Let me see if I can click on it. Oh, there we go. Cases per 100,000, 248. Okay. You see how it's starting to spread out from the top and the bottom? Imagine this were a military exercise, people. That's an army wave of viruses being spread out. Northern and southern from the very middle part. That's not a good graph. When health authorities show this to people in office, they make them aware of this. Hold on, I want you guys to be able to see that, see less of me. They want look, the Trump administration gets these type of graphs all the time. They're made to watch this, to watch it very carefully, because you have statisticians, you have people reporting. All these reporting is very important. If you don't believe the World Health Organization is very important and or vital, I disagree with you 100%. They do these numbers regardless of whether there's a person in office or not. You understand? So if and when a real lockdown comes here, I can almost guarantee whoever's in office will have to read it word for word because they're being told, hey, this is going to cause a problem. And I hope, no matter how much he wants to be president again, that he does the right thing ahead of time versus behind the scale. All right, people. I don't know this particular graph if it actually shows here in the U.S. the hotspots. I would like to actually, you know what? Let me map made with Cardo. What does that mean? National Public Health Bodies map made with Cardo. You know what? Let's do a little research. Let's see if I'll bring this up on the same one. I want to show you how I do research here because I think you guys can learn a lot by how to search for things. Okay, I'm typing in Google. I'm going to type that in. Matt May with Cardo, USA. Let's see if the US is on this. Cardo provides free visualization software, new lockdown system, pregnancy risk in football, blah, 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 blah. That was March 11th, so that can't be it. Let's click on news. Blah, blah, blah. Okay, well. Yeah. Florida in the news again. Did you guys see that? Florida. Remember, Florida was all like, oh, we're going to go back to the way it was. Remember the Florida governor? And I'm like, now the football team got it. They're like, oh, we're not going to play anymore. We're putting things on lockdown for them. Not the whole state. Not yet. These are old stories, so they're negligible. I don't like to share old stories for a reason because it's not current. So there you go. I'm going to type this in. Hotspots in, we'll start with California. Let's see, California, because that's where I'm at. And coronavirus. Check that out. Let's see if anybody has that. Charts show how coronavirus cases in the Bay Area compare to hotspots in Texas. I don't really want that. Where the California case were dropping and how far? That was 4 weeks ago. Blah, 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 blah. Let's go to this one. I think this one might be a little bit better. This was 5 days ago, by the way. Okay. Because it's true. The numbers. Oh, look at this. Click here for the latest data from official sources. East Bay Times. I don't know if I want to click on that. I might get something here that I don't want. Clickable ads. They always say that. And then they're like, whose pockets am I lining? All right, fine. I'll click on it. Let's see. Let's see if they make me pay. And I love programs like this because you can kind of just research and do the research yourself and just kind of see where the hot pockets are at. And it's good when you start seeing declines, by the way. But New York has seen upticks, by the way. So in this one, I'm gonna compare two different ones. Okay, so this is what we've been. Yeah, this doesn't really tell me anything. I like the other graph better, seriously, because you could see it. Okay, all right, this is kind of good. Here we go. Current outbreaks. Okay, so we're in a new case rate for past 14 days. Okay. So if you're a dark blue, you don't want to be Shasta County. You don't want to be the Shasta County. Got it? This is about where we're at. This is LA County, Ventura County. Hold on. LA County. This is our broadcasting area. San Bernardino County and Riverside. You see that? That's much bigger than LA County. You understand? Like a lot combined. It's a lot of land. Okay, LA County, just this part. Our radio show hits these in terrestrial radio, ABC News Radio, KMET, 1490 AM. It's a lot of people to cover. But it's relatively mild here, which is why some of these have said, hey, let's go ahead and reopen certain areas, which I say, whoa, be careful. All right, I want to see, I need to be able to see other areas. Why can't we do this in other areas? I'm sure there's a way to do it, right? Let's type in, did we do USA already? Hotspots of California. Oh, because I put California. So let's do in United States of America. Dun, dun, dun. Because you can see in certain areas, look, in Shasta County, if it's rising there, it's going to start rising in other areas. Remember, we're entering the colder season, and up north, is it colder than it is hotter? I would venture to say yes. But that goes back to something I talked about yesterday. Cold flu virus coming around. And it's not going to make matters any easier. Let's go to, you know what? Meh, let's go up. Meh. Here we go, 4 days ago. U.S. COVID cases climb as Midwestern states report steep increases. Okay, infections also ticking up in Northeast. Hello, New York. More than 57,000 tests positive for coronavirus on Friday. COVID-19 cases are again climbing in the U.S. with the highest daily rates of new infections since August, when major states such as Florida became hotspots. New data from Johns Hopkins University's COVID-19 tracker shows. Let's see, this was published October 10th. All right, that was Saturday. You see why the governor's kind of been quiet over there lately. That was last week. Oh, yeah, it was just, let's go back, I think he wanted people to be evicted again, and like people are taking advantage of the system. Yeah, well, hello, they have a hard time paying for the system. Now, several Midwestern states are posting steep increases in COVID-19 cases, with at least one setting up a field hospital to cope with the flood of patients. Cases are also ticking up in the Northeast, where tight restrictions had the virus under control for most of the summer. Wisconsin's Democratic Governor Tony Evers said on Twitter, as the state posted another record day of COVID-19 infections, we have to get back to the basics in fighting this virus. Sounds like Europe. Sounds like France. Sounds like Northern Ireland, doesn't it? The state set up a field hospital near state fairgrounds to treat what could be an overflow of patients with COVID-19. More than 8,000 people in the state are hospitalized. More than 213,000 people have died of COVID-19 in the U.S. Remember when we were just saying it just crossed the 200,000 threshold? Dr. Paul Casey, emergency department head at Berlin Health System in Green Bay, Wisconsin, says we are on the verge of a crisis in Green Bay and our surrounding counties. More than 57,000 people tested positive for COVID-19 on Friday, one of the highest tallies since this summer, when Florida, Texas, and California were national hotspots. Cases began to decrease in August, and Florida has since completely reopened, including allowing bars and restaurants to operate at full capacity. Cases are now ticking up in Florida again. But the most worrying trends in recent weeks has come from the Midwest, where towns in South Dakota, North Dakota, Montana, and Wisconsin have seen steep increases. With cases surging, South Dakota's Republican governor, Kristi Noem, accused the media of, I love this one, spreading fear about her hands-off approach to the pandemic, as Donald Trump tweeted his approval. You see? Okay. Look at the numbers, people. Look at them for yourselves. She said this: many in the mainstream media have been attacking South Dakota for respecting our people's freedom and personal responsibility. What does that mean? You have your own responsibility to be responsible. I get that. I've been saying that. You do have to be responsible for yourself and your family. Yeah. South Dakota has the second highest per capita rate of COVID-19 in the nation. Well, there you go. Let the facts speak for themselves, lady. Noem has plans to campaign. It's always that for the president in Minnesota on Sunday and Monday. Oh, so that just happened? Did that happen? I don't know. I'm late in the game. I can't keep up with all of the U.S. In the state, local media reported some high-profile Minnesota Republicans are in quarantine after coming into contact with the potentially infectious president. Oh, yeah, that's right. Oh, boy. Yeah. Don't blame me. You're fake news. Spread fear. How dare you? It's called cautionary tale. If you lost somebody that you love or have them in the hospital, that's not fear, people. That's called, well, let's put it this way. I hate it. Hold on. Let me bring this up so you guys can focus, and so I can too. Here's what I hate. Okay, bear with me here. I've been called out back in March by who I thought was a very close friend of a lot of years. You're spreading fear. How dare you? It was from a lady. She didn't sound like that, by the way. And I said, no, it's called being cautious. It's called not putting my family in harm's way. It's called, look, here's what I call it, people. If one of your family members got an infectious disease known as the bubonic plague, and if I told you, don't worry about it. They got treatment for that. Don't worry about it. Don't bother shaking hands. He'll be fine, I hope. You see what the difference when people say it's spreading fear? Okay, all right. So look, wouldn't it be smarter to say, so he's got the bubonic plague. Let's isolate him, get him the proper necessary medication, get him in front of a doctor who can treat this infectious disease. And guys, let's keep Joey over here, right? Let's not wash your hands, wash everything. That's not being the fearful parent. That's being a responsible parent. Back to when people say, you just spread fear. No, it's called responsibility. Now, I do understand some people don't deal with information very well. You ever have that family member that's, like you can't trust telling them. I remember when I broke my finger, it was bad. It was really bad. It looked nasty. Even the doctor's like, oh, that looks like it's going to fall off. I'm like, please don't tell me that. I'm the one with it right now. They're like, no, I'm pretty sure it's okay. I was the one with it. I was like, but I didn't want to call my mom because I know my mom. My mom's like, and I can't deal with that stress, anxiety, and or just like, because I'm like, keep a level head on. Okay, mom? I can't depend on her to do that. There's some people in families that just, you can't depend on doing that. So I say, limit the information that she gets. That's why I tell her, don't stay on the news too much. Just put it in its proper perspective. Back to an earthquake. If an earthquake happens, some people are like that. Other people are like, it's just 1 in a billion, right? It's not the big one, although it could feel like the big one all of a sudden. Then you go, well, at least, are you prepared? Are you prepared? Okay, good, done. If the house is starting to fall down, what do? You run out, right? That's not spreading fear. It's called run for your life, right? In the moment. But better to be ahead of it than behind it. There's so many people, back to people saying fake news. I'm like, did you do the research? It's actually real news. It's just, just because somebody calls it that doesn't mean it is that until you do the research for yourself. You understand? Back to spreading. I'm not spreading fear. I'm spreading numbers. These are numbers. These are facts around the world, not just here in the U.S. Mainstream media wants you to be blinded by the truth that the coronavirus is a global phenomenon that isn't meant to actually hurt and or harm you. It is an imaginary cautionary tale against the president. I literally had somebody from this radio station say that on his radio program. Okay. Agree to disagree. I don't like the guy. I'm not going to throw his name out there. Maybe I should. I'm going to wait. But he called the general manager, saying I was spreading, what do you call it? War profiteering by showing people that they could buy a product at a discounted rate because they had the hookup. It was a UV sanitizer thing, which is why I don't really talk about it on the show anymore or anything, because he tried to get me basically in trouble with the radio station. Well, he uses the KMT logo. You sure you want that? Basically was the discussion. And I got called by the general manager. The general manager was like, and I said, look, it's my profile. I can do what I want. It's my Facebook feed. You guys don't even pay me contractually anyway. But okay, I'll take down the ABC logo off of my profile wall at the very top. So I changed it out with the morning show. That's the story behind it. And I said, I would be cautionary with somebody throwing that type of tale, because it's one thing to throw conspiracies out there that don't affect people to like get dead. I'm just going to throw that out there. When you throw one out there and it's to show that, no, don't worry about it. You're not going to die. But this is why I have a problem with certain religious organizations. They're like, I'll heal you. Okay. So you're God all of a sudden? You're the promised Messiah come to rid disease and or everything, cure people willy-nilly like that? Okay, I'd hate to be you, right? There are certain people out there spreading what I call false hope. All right? Don't be one to spread false hope. What I mean by that is, back to the bubonic plague. Don't worry about it. It's going to be done. Don't even worry if you shake that guy's hand. It's okay. Agree to disagree. That's called false promises based on false hope. Do you understand the difference? A doctor, when he has to come and make an analysis of a situation, tries to do the very best, saying, look, these are the 3 options we have. Your husband and or your wife are in critical condition. We need to make a choice. These are the choices that you have available. I think this one would be the better option, but it has a certain level of risk. You need to know about it. Well, how high is the risk? It's 30% on average. Well, okay, that sounds like a low risk. Well, the second alternative has about a 12% risk, but what I mean by that is 12% of the people actually die on that one. So I'm trying to go with this one. That's a secondary option if this first one doesn't happen. Are you okay to do? Well, what's the third one? Well, the third one is the last, like the very last end of it all, because it's not you may be unable to walk at the end of the day. We're going to have to amputate the leg. He has gangrene. In that moment, that is not a doctor spreading fear. He's dealing with analysis of a given situation. Okay, that's a difficult decision to make right here, right now. What do you think, Doc? I say we go with the first one and we work our way down. Hopefully we can nip it in the bud. Hopefully we can stop it before it's in its tracks. But we have to make a decision now. It's spreading rapidly. Okay. All right. Whatever you want, Doc. But just yeah. That's not spreading fear, people. That's spreading information that needs to be heard by the parties responsible for the person whom they say they love. There are many people right now in hospitals making very difficult decisions away from the political realm, having to deal with very difficult decisions with hospital members, nurses, staff, and sometimes doctors, but the doctors have little time. So that conversation usually doesn't happen that calm and subdued. It usually is this is what we have. He has fill in the blank. If you've been on the receiving end of that type of discussion, it can happen like that. I know that happened to my sister back in February. You don't have time to think. Okay, what are our options? Boom, boom, boom. Okay. All right, let's do that. You say that's this, and you have to trust the doctors that know what they're doing. I'm one who doesn't trust all doctors, and especially when I see fear in their eyes, which I saw in two of the doctors go, because they were young. They're like, I've never seen anything like this. What is this? So I had to go call up a trusted friend. Hey, by the way, I know you know a lot of doctors. Can you give me some information on the side? So I had to go outside of the doctors and be my own sister's advocate. To which, in 3 different occasions, a hematologist, a doctor, because they had rotated the new doctor didn't have all the information that the other 2 doctors had tried to hand off because, it's just like brand new into this. Okay, let's see, because they switch them out so fast, so furiously, right? You don't have one doctor for any one thing. So you have to make sure that the doctor knows what the previous doctor said. So I had that discussion on a Sunday afternoon on the telephone. Well, okay, they wanted to put a feeding tube in my sister's stomach because she couldn't swallow properly. The food was going into her lungs. Okay? Just hold on there. My sister has special needs, people. You put an apparatus on her stomach, number one, she's going to say, what the heck is that? And want to pull at it and rip it out. So forgive me, I said to the doctor, but I said so calmly. I said, look, she's special needs, right? Like she can't hear. You can't explain it to her that that's a feeding tube in her belly. Can we, and I threw this out there because I felt like they were just ready to let's put it in. Let's get her out. Right. Which they were. Back to costs. Right. She has state insurance. So it doesn't pay a lot. I get it. But my point is this. Here's what happened at the end of that conversation. The doctor says, yeah, okay, we'll try that out. Which here's what I suggested. It was simple. Quick question, doctor. When they did the what's that called? He said, oh, when they intubated her. Yeah, that. When they intubated her, I saw a little bit of blood kind of spill up on her. Like, is there a possibility? Thank God I watched TV shows where they sometimes, they put it in, but it disrupts the throat larynx. Right. So I said this, is it possible that maybe it just got kind of either ruptured or I don't know what the term is, but maybe it got bruised and maybe it's not closing right. Cause that's what there's a tube that actually closes when you eat. So it goes down the right pipe. If you've ever choked, it go, right. You're like, oh, it went down the wrong pipe. Right. So that muscle wasn't working at the time. And so I said to the doc, I said, look, doc, can we give it a couple days at least for her to hopefully mend? I'm hopeful her body will mend. Oh, yeah. Okay. Yeah, we could do that. Yeah. Okay. Yeah. That could be a possibility. Actually, that has been known to happen, he said to me. I was like this. Okay. 3 days later, they tested her. Everything was fine. And it was a new doctor. The doctor's like, yeah, we want to release. I go, can we just, because the other one was so ready to put in a feeding tube in the stomach. I just want to make sure there's no, well, he goes, well, we just did the test. The specialist came in. There's no food going down the lungs. And I'm like, you have no idea what I had to fight in order for my sister not to have a feeding tube in her stomach for life. So you could do the least and keep her for observation another day or two, just to make sure, because I'm willing to do the right thing by my sister. If she needs a feeding tube in order to keep her alive, then okay. But it's a last option. Do you understand? Now, I wasn't as adamant with the doc with that. Thankfully, I had hope. Back to my lady at the time. Shout out to Brenda. Brenda, smart woman, knew to speak to the hospital staff in such a way that they're like, okay. That way I didn't come off so crazy and so adamant. It's my sister. Okay, I'm sorry, but one doc said, oh, no, we're going to put a feeding tube. That's what we're going to do. No, I'm not going to let you until we see if she can, maybe you guys damaged is what I wanted to say. Now, was I willing to sue them? No, I just wanted my sister alive and okay for the rest of her life. Not pulling at some apparatus stuck in her stomach. My sister's special needs again. She's 100%. Like when I say mentally disabled, that's not even the half of it, okay? They used to call it back in the day before it was PC, not cool, mental retardation. Okay, that's my sister. Sorry, but it's reality for us. Okay, so sorry, doc, if you don't understand how she's going to take issue with the apparatus in her stomach when she pulls at bandages and or things that are left on her. She's like, "What's this?" You can't explain to her. She's one that won't wear a face mask. She's in 100% lockdown because homes like that are 100% locked down already. They're not letting anybody in unless hospital staff comes in and or special people that come in. But look, my point is this: sometimes you have to be an advocate for your family member. And I'm sorry, but the president of the United States has thrown so many caution to the wind ever since, we'll say April. There's a reason people are upset, mad, and angry. There's a reason that even though he's like, hey, I'm fine. Dancing, I'm fine. I say, good job. Awesome. You didn't end up in the hospital like what? Maybe at least 180,000 hospitalized that now are dead because of it. And we didn't talk about the ones that got well. My sister's one of the ones that got well after 5 weeks of rehabilitation, by the way. And she got it twice. Thankfully, she fought it the second time. We pumped her so many medication to end plates, very big. Look it up for the platelets in your body. If you're seeing a platelet drop, check it out, platelets. So my point is this, okay, people? In life, sometimes you have to say, look, this isn't fear being posted. This is called be alert. Be awake with your mental sense of mind. Do not get lulled into a false sense of what? I just want to have fun, people. Okay, I've heard that. It's my life. I'll do with it what I want until you're in the hospital with a tube down your throat. Okay. Don't be such a buzzkill. I'm not a buzzkill. It happened with my sister. You know how many people I've had to talk to which say, I don't know, I think this is fake. Back in August, okay? 5 different people until I said this. You know, my sister almost died of coronavirus. Wait, what? Yeah. At the time, it wasn't mandatory to test for it, but everything that could go wrong went wrong. They don't know the half of it. Back to the feeding tube. I didn't tell that story to a lot of people. A lot of people don't know that story. It was touch and go that week, which is why it was very difficult for me to do a morning show that week. It was a couple of weeks, by the way. So people, I've lived through this. Back to my sister. I wasn't the one with it, but when you have to see almost your sister die from it, I'm not spreading fear. Back to the friend who says, "Oh, you're spreading." I go, my sister. I don't think you understand that. And the person went on to say, "Get this. Well, my family's going to be fine because we're O positive, and because we're O positive blood. I've done the research, and I have an understanding of biology. And biology says, and if you guys have seen the article, she's not 100% wrong. She's actually more right than wrong when it comes to the initial analysis because O." If you do the research, O positive or just O type blood. What's it called? Positive or negative? I know it's just O. O blood type. At least with the first stage of coronavirus, seem to be, it's not all one size fits all, by the way, back to underlying conditions, seem to be more resistant against coronavirus than other blood types, okay? Sometimes it's good to know your blood type for your family members. However, having said that, here's what I feel like saying to the person. Did you account for it mutating? Did you account? Oh, do you not get sick from a cold? Do you not get sick from a flu? And do you always get okay? Well, that's good. So you're pretty resistant, huh? We should like bottle up your blood and make it mandatory for everybody to have that vaccine. Yeah, about that. In reality, look it up. This virus has mutated around the world. It does not always show itself the same way. And unfortunately, it's actually triggered other diseases to become suddenly active in the body. You don't believe me? Look it up. Science is proving that here and now. Some of them want that out there. Some of them don't. It doesn't matter. My point is this. Just put on a freaking face mask. It's simple. You don't need to know the biology to know you can get sick. You don't need the biology to know you can transmit it to others that may not be as healthy as you. You don't need biology to know. Just do the right thing. I defriended that person, blocked them from my social media, and says, we're never, ever doing business ever again. Actually, I never said that last one, but in essence, if she were watching, we're never doing business again because I can't trust you to do the right thing for the American people and or your family members. Do you really want that person in your life? The person that's like, I'm immune, but I don't know about the rest of you. So if you get it, you're pretty immune, but you may transmit it to somebody who's not, is what I said. I have the text to prove and back up every single statement I'm making, by the way, because I saved them to remind myself, oh, there are some people out there that really think they're above it all. Huh. That was back in March. Lost a good friend, long-time friend. Never will be friends with that person ever again. Because I found out other stuff behind the scenes that were happening. So I say, makes sense where your heart's at. People. There are some out there seeking to do harm by spreading false information and or rumors and or just, don't worry about it. Don't worry about it. It'll be fine. I call them the person who wants the good person to end up. I'm not going to call that out because it might be a little too traumatic for some people to say, what? How dare you call me that? So I'm just going to refrain from saying stupid, dumb, idiotic, false, misleading, protagonistic. Man, that word's too strong. That word's way too strong. You fill in the blank. Don't be that person, okay? Don't be my once trusted friend and soon to be big dummy. Because here's what I foresee. This thing is not going away anytime soon. We have at least, at minimum, a 5-year run if we don't find the proper cure and be able to make enough for the whole world, by the way. We're not only in it to win it here on the home front. We're in it to win it around the world. So I can almost imagine statistics will show that eventually, within even just 2 more years, here's where the statistics will be. Okay, I'm going to go on record saying this right here, right now. You can pull it up in 2 years, see if I was right or wrong. If we don't get a handle on this right here, right now, do the right thing, make it so that we could still financially not suffer through it, but maintain. Economically, do the right thing by businesses and people. Buckle it down, so to speak. All of us doing the right thing, which that's not even possible. You always have clusters of people going, no, but I don't believe this stuff. This guy is wrong. He's spreading fear-mongering, blah, blah, blah. Don't listen to this guy, right? Wait till you have somebody in the hospital, okay? And then you'll change your tune. I hope it's not you. I always say I want to be wrong about all of this, but as of March beyond, if you look back at my record, it's 100% correct. Maybe like 98%, but it's pretty close. Okay, everything I've ever said has come true, and I say I'm okay about being wrong. I'd love to be wrong on this. I don't want to be right. I'm the last one that wants to be right. Getting this from somewhere, though. In the next couple of years, the death toll will be approximately 485,486 a year from now. Look it up. We're October 15th, 2020. And that's all I'm going to say about that. See if I'm right. And if I am, it's a sad day in history. Does it change your perspective on things? What if I said 1 in every 5 family members will have at least had it once? Of those that get sick, it's no longer 3% that I said the other day. It's more like 8%. Because now it got combined with the flu and or the regular cold. Look, does it matter what number I throw out there? Not really. Because at the end of the day, history will be forever etched in stone that somebody did the right thing and somebody did the wrong thing. Back to my friend. I hope my friend doesn't get sick for being callous, unfeeling, and unloving. I always say, I talk about this information. I've lost my job because of it with a certain TV station. Almost lost my job here at the radio station because of another broadcaster that said I was wrong for sharing a UV light that kills bacteria because I was war profiteering. I'm like, you got to be an award in order to profiteer from. And I say this, look, people, don't call me out. I'm just trying to save people. I'm just trying to be the voice of reason in the room. I'm just trying to be that person that I say, if you're the president of the United States of America, you need to be that person. You need to be the solid mind of the mindset to be able to say, look, people, I know we're in a very difficult time. This is a difficult time for all of America. It's not an easy time to get through. We're going to do a minimum 3-week and for all the businesses out there, we're going to pass the stimulus law. I'm putting it into action right here, right now. We're going to make an additional 500 billion. I know people are like, well, where are we going to get the money from? I don't know. Look, it's possible. You know what? Okay, fine. Maybe not 500 billion. Look, we're going to do a mandatory minimum halt all payments. If you owe a banker and or creditor, we're figuring stuff out behind the scenes to make it mandatory that these creditors and or that they get paid no matter what. So they're going to turn in their stuff. We have a special task force assigned to this credit team. We're calling it the Creditors of America plan. Any person who has an outstanding debt is going to be taken care of just to get us past the next month. Be with your friends, be with your family, isolate, self-isolate, do the right thing. Food's going to be taken care of as well. And don't worry. This is a world pandemic, not just an isolated event. We got to get through the next 3 weeks, okay? I think we can nip it in the bud because it is a bug, and it's bugging all of us, and we need to just do the right thing, okay? If we all stay home 3 weeks, I'm pretty sure we could almost eliminate it from spreading, okay? But I know it takes a whole community to get down with it. You imagine it's an extended holiday, people, okay? It's an extended holiday. We're freezing. All creditors, debtors, we're taking care of you 100% for the next month. Okay, let's do that. But we have to do the right thing, people. We have to do the right thing. I'm your president. Thank you and good night. How difficult is that to say? Not quite difficult. You know, in times of war, of real war, a war president says, it's my regret to state we're at war. ... For the next so many days, we're going to have to, whatever that is. You understand? Talking about so much information. It's sad. It is, because now I have to completely revert to something else I said about China. Okay. Whether you believe it or not, it's now made the national headlines and international world news. You can check it out. CNN even posted it. I posted it before it was posted on any of the other ones. And I posted it from WIO News, which happens to be from India. Here is the headline, and I posted it yesterday. Nobody other than two people says, "Oh, I like that. Thank you for sharing that." Because nobody understands what the heck is going on because they don't watch the morning show on my personal profiles. I get it. Prepare for war, be absolutely loyal. Xi Jinping tells Chinese troops. This was as of yesterday. But what have I been saying here on the morning show? To those of you that watch, you go, "Oh yeah, well that makes sense. You've been saying that. China and India at odds with each other." Here's the rest of the article, and this has been, I'm pulling it up on CNN. Let's see what they say on this, okay? Don't believe me, look it up. It's now national headline news. If you just look it up. War, okay? Here it is. CNN posted 1 day ago. The Hills posted it as of recently. Here's their spin on it. Here it is. Chinese President Xi Jinping has called on troops to put all their minds and energy on preparing for war in a visit to a military base in the southern province of Guangdong on Tuesday. That's according to state news agency Xinhua. During an inspection of the People's Liberation Army Marine Corps in Chaoshao City, Xinhua said Xi told the soldiers to maintain a state of high alert and called on them to be absolutely loyal, absolutely pure, and absolutely reliable. If you're a president of a nation like China and you say those words, what does that mean? The main purpose of Xi's visit to Guangdong was to deliver a speech Wednesday commemorating the 40th anniversary of the Shenzhen Special Economic Zone, which was established in 1980 to attract foreign capital and played a vital role in helping China's economy become the second largest in the world. But the military visit comes as tensions between China and the United States remain at their highest point in decades, with disagreements over Taiwan and the coronavirus pandemic creating sharp divisions between Washington and Beijing. The White House notified U.S. Congress Monday that it was planning to move ahead with the sale of 3 advanced weapon systems to Taiwan, according to congressional aid, including the Advanced High Mobility Artillery Rocket System. This is what I was talking about the other day, by the way. In a stern response from Beijing, Foreign Ministry spokesman Zhao Lijian called on Washington to immediately cancel any arms sales plans to Taiwan and cut all U.S.-Taiwan military ties. Yeah, somebody positioning for something to go down. Let's see. The story goes on to read, blah, blah, blah. Long story. All right, not too much more. But look, here's the reason I have problems with this article. Watch. The article that I posted it, because it was from an India news article, says this. Chinese President Xi Jinping on Wednesday directed China's armed forces to strengthen training of troops and to be ready for war amid Indo-China face-off in eastern Ladakh along the line of actual control. Now, that one makes more sense than the other because everybody's like, this is when it's the U.S. against war. I mean, yeah, we got war of words, but I don't know that we were going to go to war, right? But if you've been keeping up with the morning show, you understand what's been happening with the line of actual control. But it's multifaceted, people. There are ships in the waters of China, from the U.S., from Australia, from other countries that are in the southern China seas. Don't believe me, look it up. They're posturing for who has the sovereignty right to be able to have control of these seas, right? It's all about money at the end of the day. It's happening on multiple fronts. China's getting surrounded by a lot of nations. Obviously, they've made deals behind the scenes to be able to say who's going to back us up if we go to war, right? Which many often believe North Korea, China, and Russia, and probably others as well, will join forces against the other nations. You understand where I'm going with this? Let's see. According to a report published in CNN, okay, so they're crediting CNN. Xi Jinping has called on troops to put all their minds and energy on preparing for war and a visit to military base in the southern province of Guangdong on Tuesday, according to state news agency Xinhua. So there's kind of commenting on the same thing. Let me see where it kind of goes back to what I was talking about. It was not yet clear whether this comment was directed towards India, Japan, or the U.S. You see that? That's why I like this news article. It's a little bit more broader. And other countries with which China is embroiled in a tussle in the South China Sea region. You see, this was gives you a lot more facets to the story than just the CNN article, which is very slanted. It's almost like the U.S. against China, right? No, you need more information to use your thinking mind. Earlier on Tuesday, the Chinese Ministry of Foreign Affairs had said that Beijing doesn't recognize Ladakh Union territory in Arunachal Pradesh. The Chinese MFA in a statement said that the Ladakh Union territory is a region illegally established by India. That's that little border I keep talking about. Come on, people, grow up. It's a little bit of territory. Why are we going to war over this? Seriously. Meanwhile, India and China had sincere, in-depth, and constructive exchange of views on disengagement along the line of actual control. The Indian Army said following the 7th round of the Corps Commander level talks. In the 7th round of Corps Commander level talks, here's where I have a problem with that. Why are you having commanders talk? Why don't we get the main guys in the room, okay? Put those two in a room. Seriously. India continued to demand complete disengagement and de-escalation by the People's Liberation Army from the eastern Ladakh sector. Government sources had said, quote, India is expected to demand a discussion on all the friction points between the two sides from the subsector north to the central sector and complete disengagement and de-escalation by the Chinese army from there. Look, either side of the aisle that you're on, Chinese or India, I've often said, I don't agree with Chinese culture right now. You know, look, and I've said this time and again, China has been making it impossible for people to not choose their own faith. You understand what that means? You can be Buddhist, you can be Muslim, you can be Christian in other countries, but you can't be in China. So that alone is reason for me to say, let's go take the guy out. I'm the first one to sign on that document. I'll take him out just on that alone, but not for territory. Seriously, this is a border issue. Build a wall. Done. Solution. I have problems with Xi Jinping making it impossible for you to just worship in your own way, and you get locked up for it. Yeah, go to prison and are beaten down. Don't believe me? It's already happening in Russia. Did a news article on that. Some of you haven't seen it. Some of you have. They're not the only religion. I covered something on Jehovah's Witnesses, but Jehovah's Witnesses are not the only religion. There are other Christian faiths, Muslim faiths, and or Buddhist faiths that are enduring persecution of the mind, meaning you can worship me as your dictator, but not it or that or whatever you want to profess faith in. I am your God, in essence. I can help you, right? It's like, imagine if Pharaoh back in the day, right? That's what Pharaoh said. Don't believe me, look it up. 10 Commandments, right? Who is this God? I do not know this God. Pharaoh was a god in his own mind. Seriously. Smart man. Not. Ended up losing how many people at the end of the 10 plagues? Woo! I wouldn't want to be him. So I'm the first one to say, you know what? Let's go to war with China, but not the people. Let's take out that evildoer, the top one, or whoever else professes that they're right and everybody else is wrong based on the faith that they want to, put themselves under. Look, at the end of the day, that's my only reason to want to go to war with China. It seriously is. That's my only reason, but not with the people. Heck no. I say, hey, people, you want help there? I'll help you out. Seriously, if I were the president of the United States, based on that, I would go to war, but not over money, southern seas. Look it up. It's interesting. Everybody's trying to get control of next to there's a canal which is melting, okay, as we speak. Between, you know how close Russia is to Alaska? They're just like a hop, jump, and a skip over, right? So there's a canal there which is melting, and as it's melting, well, there's opportunity for ships to be able to use that section of water, right, to transport things. It's back to consumer goods. Don't believe me? Look it up. It's a really good doc. Actually, it was a YouTube video that I found, and it was very interesting. Broke it down. I was like, wow. So Russia wants control of that. So does the U.S. How do you make room over a piece of not land, but waterway, right? Well, if it's melting, that means ships can go through there using that easier to get to where they got to go. A lot of shipments don't come in through plane and or train. They come through ships in the seas. You understand? Back to pirates. You don't want pirates out there because then they're just like, hey, give me your goods, right? All right. So look, it's definitely not the days of the Caribbean, but you know, Pirates of the Caribbean is a real thing. Still, they're still profiteers. Let's just put it that way. That want to profit from financial goods. It's called money. Without the money, all of a sudden, everybody's like, oh, we're all on the same page. Okay, right. But that can never happen, right? All right. So look, people, I appreciate you. I'm just saying, don't throw caution to the wind. Be smart. If I put up the numbers, do the research for yourself. Back it up, anything you say, anti-me, with facts, real figures, not false claims or false hyperboles. Don't do that. Okay, be smart about it. Okay, people? Be smart. I love you guys. I really do, because you guys are smart thinking people. You stick with me and you go, yeah, it makes sense. Let me go to the comments here. Let's see. Rosalie just tuned in. Says, I'm going to have to see the replay. Missed everything. Super busy at work. Call after call. Yeah, well, you know what? You missed a really good full show, actually. But I say the second half is even better. We broke it down. You just have to push replay. It's okay. You can get caught up. Let's see. Let me scroll up. Let's see. Yeah, Maria says this. I don't know if I want to say that. It says, oh my God, because of what you showed us the other day, you almost lost your job. That is, yeah, it's bad. Actually, yeah, seriously. But I didn't lose my job just yesterday. I would have lost it, like, I think about 3 months ago when I shared it. And then I was like, really? All because of some other broadcaster? You want to trust that guy? And I said to the general manager, I says, your dad's sick, right? Yeah, okay. He has a hard time going to the hospital because of coronavirus, right? Even if coronavirus was fake, just throwing this out there, even if it was not real and it was made to slant against President Trump, which was what the other broadcaster was saying in essence, because that's his show. Trump is awesome. He's amazing. This is all conspiracy to make him look bad. Okay. Anyway, I'm not going to call that broadcaster out because he's a paying broadcaster. You get what I'm saying? He pays for his airtime. Some broadcasters pay for their airtime. I don't. Thank goodness. But I try to throw caution to the wind all the time. I want people to just, stop wearing face masks and go out and not even worry about it. It's because, you know what? It's called hoop. I'm not that guy. Okay? No, I do exactly the opposite of that guy. And I say, who would you rather have in your on your station? Somebody saying, "Hey guys, let's not do something stupid," or do you want the guy that says, "Go into the fiery burning house and just sit there. You're not going to inhale the smoke because you are 100% perfect." In essence, that's kind of what I'm seeing from the pulpit of who doing what to try to get a vote in. All right, people. That's enough. That's all I'm going to say there. Look, if you see the show, it's got balance. We did talk pro-Trump in the first hour. Don't believe me? Look it up. I'm not all bullying or bashing somebody that bullies and bashes everybody else other than himself. I'm not always that guy. Sometimes I'll back up when it makes sense. All right. Go check it out. All right, people, I love you. My time is done here. Make it a great day, whatever you do. Remember, life is worth living. We will talk to you around the corner. Bye-bye, everyone.